If you've been diagnosed with Crohn's disease or know someone who has it, you might have a lot of questions. What exactly is Crohn's? How does it develop? And most importantly, is there hope for a cure? With over 780,000 Americans living with Crohn's disease and millions more worldwide, this chronic condition affects more people than you might realize. The diagnosis rate has been steadily increasing by nearly 30% each decade since the 1950s, making education about this condition more important than ever. In today's video, we'll break it all down in a way that's easy to understand, from the underlying mechanisms to the latest treatment breakthroughs that are giving patients new hope. Whether you're newly diagnosed, a caregiver, or just curious about IBD, this comprehensive guide will give you the knowledge you need, so stick around. Let's start with the basics. Crohn's disease is a type of inflammatory bowel disease, or IBD. It causes chronic inflammation in the digestive tract, which can lead to symptoms like abdominal pain, diarrhea, fatigue, weight loss, and even malnutrition. The tricky part? It doesn't affect everyone the same way. Some people have mild symptoms, while others experience severe flare-ups that impact their daily lives. The inflammation caused by Crohn's can appear anywhere in the digestive system, from the mouth to the anus, but it most commonly affects the small intestine and colon. Unlike other digestive conditions, Crohn's can cause deep ulcers and thickening of the intestinal walls, which may lead to complications like strictures, fistulas, and even the need for surgery. So, what actually causes Crohn's disease? The exact cause isn't fully understood, but research suggests that it's a combination of genetic, environmental, and immune system factors. Let's start with genetics. Scientists have found that Crohn's disease tends to run in families. In fact, if you have a parent or sibling with Crohn's, your chances of developing it are higher. But it's not as simple as inheriting a single Crohn's gene. More than 200 genetic variations have been linked to an increased risk of IBD. One of the most significant discoveries in Crohn's research was the identification of the NOD2 gene mutation. Back in 2001, researchers found that mutations in this gene can increase the risk of Crohn's disease. The NOD2 gene plays a role in how the immune system responds to bacteria in the gut. When it doesn't work properly, the immune system can overreact, leading to chronic inflammation. But genetics alone don't explain everything. Many people with these gene mutations never develop Crohn's, which means that environmental factors also play a big role. Things like diet, stress, smoking, and even gut bacteria may all influence whether someone with a genetic predisposition actually develops the disease. Normally, the immune system protects us by attacking harmful invaders like viruses and bacteria. But in people with Crohn's, the immune system mistakenly attacks the digestive tract, causing persistent inflammation. Researchers believe this might happen because of an abnormal response to gut bacteria. Instead of distinguishing between harmful and beneficial bacteria, the immune system goes into overdrive, leading to chronic damage in the intestines. This immune dysfunction involves several key components. T cells, which are specialized white blood cells, become hyperactive in Crohn's patients and release inflammatory proteins called cytokines at much higher levels than normal. Studies have shown that people with Crohn's disease have up to 10 times the normal concentration of TNF-alpha tumor necrosis factor alpha, a particularly powerful inflammatory cytokine that drives much of the intestinal damage. The intestinal barrier, sometimes called the gut barrier, also plays a crucial role. This protective lining normally prevents bacteria from passing from the intestine into surrounding tissues. In Crohn's patients, this barrier becomes compromised or leaky, allowing bacteria to trigger immune responses where they shouldn't. Recent research from 2023 has revealed that this barrier dysfunction may actually precede the development of full-blown Crohn's disease, potentially offering a window for earlier intervention. Is there a cure? What about new treatments? Now for the big question. Is there a cure for Crohn's disease? Unfortunately, not yet. But don't lose hope. There are more treatment options today than ever before, and research is moving fast. Right now, treatment focuses on controlling symptoms and reducing inflammation. This often includes medications like steroids, immunosuppressants, and biologics, specialized drugs that target specific parts of the immune system. Biologics, like infliximab, Remicade, and adalimumab, Humira, have been game changers for many patients, helping to keep the disease in remission. Recent studies show that over 60% of patients achieve clinical remission with these targeted therapies, compared to just 30% with conventional treatments a decade ago. But scientists are working on even better treatments. One promising area of research is JAK inhibitors. These are small molecules that block certain pathways involved in inflammation. Unlike biologics, which are given as injections, JAK inhibitors can be taken as a pill. A new JK inhibitor, upadacitinib, has shown encouraging results in clinical trials, with remission rates reaching 48% in patients who didn't respond to other treatments. Another exciting development is stem cell therapy. Researchers are investigating whether stem cells can help repair damaged tissue in the intestines and even reset the immune system. While this is still in early stages, it could open up entirely new possibilities for treating Crohn's disease in the future. A 2023 pilot study showed that 73% of patients receiving mesenchymal stem cell transplants maintained remission for at least 12 months, offering a glimpse of potential long-term solutions on the horizon. If you or a loved one has Crohn's, it can feel overwhelming. But remember, you're not alone. Millions of people around the world are living with this condition, and new treatments are constantly being developed. While medication is key, lifestyle changes can also help manage symptoms. A balanced diet, stress management, and avoiding trigger foods can make a big difference. Some people also find that probiotics, vitamin supplements, and regular exercise help them feel better. Creating a symptom journal can be particularly valuable. Tracking your diet, stress levels, and symptoms can help identify personal triggers and patterns that might not be obvious otherwise. Many patients report that this simple practice helps them regain a sense of control over their condition. So, to sum it all up, Crohn's disease is a complex condition with genetic, environmental, and immune system factors at play. While there's no cure yet, research is advancing quickly, and new treatments are offering more hope than ever before. If you found this video helpful, don't forget to like and subscribe for more content on IBD and chronic illness. And if you have any questions or personal experiences to share, drop them in the comments below. Let's keep the conversation going.